I'd not been to any of the hotspots around the world. So that raises the question, well, how did she end up with coronavirus?
The 3 new cases bring the total number in New South Wales to 16. Around the country, it stands at 42. One of the new cases involves a woman in her 50s who works at the Baptist care-run Dorothy Henderson Lodge in Macquarie Park. She had contact with 13 residents at the aged care home. One of them, an 82-year-old man, now has the virus, while a 95-year-old woman has died. The health department is waiting for test results to establish whether her death was linked to coronavirus.
Today we've deployed infectious disease doctors to the facility to further assess patients there and ensure that all procedures are in place.
I'd also say to other aged care facility operators, please take every step to ensure all of your staff understand that we have a heightened risk factor now.
For now, only part of the aged care complex has been quarantined. Rosalind Harris was visiting another resident in the building next door.
It's been fine, same as usual. Just visited the lovely lady I visit. She's fine.
Meanwhile, the health department is under scrutiny for the time it took to reveal a doctor at Ryde Hospital had contracted the virus. That prompted 13 doctors, 23 nurses, 4 other health workers and 8 patients to go into isolation for a fortnight.
We tested them and we'll continue to test them for the 14 days that they have any illness.
But Macquarie University has been rocked by confirmation that one of its lecturers has the coronavirus. He had just returned from Iran, but had not set foot on the campus grounds since he got back.
Actually, I'm worried, and my family back to my home, they're also worried.
The nation's Health Protection Committee is now considering more travel bans for Iran, Italy and South Korea.
We will commit that if they advise for stronger action, we'll take that action.
A glimmer of hope, though, for the passengers evacuated from the Diamond Princess. They may be heading home at the end of the week. Philippa McDonald, ABC News.
The Australian Medical Association is concerned the spread of coronavirus has led to a degree of panic and misinformation.
AMA President Dr Tony Bartoni says the confusion has created an atmosphere of unnecessary alarm.
Clearly this has been an evolving picture, and it's been one where the information has had to keep up in real time with the evolving picture at the front line. So to the Australian public there's been a continual messaging right from the beginning, and unfortunately there has been a degree of panic and misinformation creep in, and that's seen unnecessary alarm and unnecessary panic buying, as we've seen on some of the images. And what we need to ensure is that we're really if we've got a travel history, if we've travelled through any of those countries that are now of the 78 countries or more where there have been cases reported, and we've got symptoms, we really need to self-isolate until we can make contact initially by phone or whatever other measures with the surgery, with the ED department, with the hotline, to see if we have truly got a potential suspect case, and then make sure that we get the testing required, ringing ahead and informing. But otherwise it's about ensuring that any symptomatology, any symptoms, runny nose, cold, coughs, sore throats, fevers in this current climate, we really should be self-isolating ourselves from the community and practicing, simple measures to reduce the spread at this vulnerable time.
It is a fine line, isn't it? On the one hand, we're worried that perhaps people are overreacting on verge of panic, yet you still want community vigilance.
And look, I know it's a fine line, you might say, but it's important. What we don't want is a serious opportunity for containment to be missed. If we've got let me put it a different way. If we can contain whatever the escalation to the next phase for as long as possible, that will mean that any peak will be softer and milder and more prolonged down the line. It will give an opportunity to all the healthcare staff and facilities and people at the front line trying to manage this, the opportunity to protect both themselves, the public and the community from the potential effects of if the disease was allowed to spread unwittingly right through the community. And that's the message that we've got to be. Be vigilant, be concerned. So, be respectful of others, and if we've got symptoms, we should be staying away from work. We shouldn't be engaging in the community at this time where anxiety is at a premium.
Tony Bartoni, I just wanted to raise that one case there of the doctor that was diagnosed with COVID-19 at Riot Hospital in Sydney. That's had a knock-on effect for that hospital and its staff, because now there are 40 staff from the hospital who've been quarantined. That includes 13 doctors and 23 nurses. That's just one case. Are you concerned that if we have more instances like this, that this will put severe strain on the health system because the health staff will not be available? They'll be in quarantine.
And this is one of the many factors that goes into the response to this potential pandemic as it's evolving through our community. Our hospitals and our facilities, our GPs on the front line are all doing an amazing job and effort to try and keep the community safe during this time. But they're stretched, they are under the pump, and what we need to ensure is that we can minimise the load on them. But as things escalate, we will obviously have to review the balance between resources dedicated to the COVID-19 as opposed to all the other activities that we expect our hospitals and our GPs to provide. We need to ensure that GPs in the front line, as are the ED doctors in our hospitals and all the other healthcare workers, are protected to any unwitting spread or any exposure to the infection. We've seen what the knock-on of one can be, and we need to realise that absenteeism because of enforced quarantine is going to be a significant issue to deal with, and that's part of the plan to the response in the pandemic preparedness.
The death toll from the coronavirus continues to rise across the world. The World Health Organization says 3.4% of people with the disease have died, well above the rate for the seasonal flu, which is less than 1%. But there's growing optimism in China. The number of new infections there has dropped to its lowest level in weeks. It's still by far the hardest hit country, with more than 80,000 infections and 95% of the world's fatalities. In Italy, deaths have jumped 50% from the previous day. The death toll there is now the highest outside China, slightly more than in Iran. In that country, 54,000 prisoners have been released to try to stop the spread of the virus in crowded jails.
The economic impact of the virus is worrying central banks and governments around the world. The US Federal Reserve has made an emergency cut to interest rates, the first since the global financial crisis.
In Australia, there were some better than expected economic figures, but they were for the period before the bushfires and coronavirus. Here's finance correspondent Philip Lasker.
The market turmoil intensified as the world's most powerful central bank acted dramatically. The Federal Reserve delivering a 0.5% emergency rate cut 2 weeks before its usual meeting.
So, I think it really underscores how worried central bankers are about mounting downside risks to global growth, or in the Fed's case, the US economy.
It triggered another stock market rout in the US and Australia, while other markets steadied at the prospect of more economic stimulus. South Korea announced it's spending an extra $15 billion. Details from Canberra are yet to emerge.
We will be announcing a series of measures which are designed to keep businesses in business and Australians in jobs.
But analysts say time is not on the government's side.
What really needs is a quick response, a spending that's really going to get into the economy straight away.
But before the bushfires and coronavirus struck, the economy was stronger than expected. Growth jumped 0.5% during the December quarter, leaving a faster annual growth rate at 2.2%. Spending by consumers and the pickup in the housing market were big contributors.
This is what happened, and really what policy makers care about today is what's coming down the pipe.
As the US Central Bank pointed out, interest rate cuts won't reduce the rate of coronavirus infection. Central bankers won't end this crisis, scientists will. And until that happens, Australia's record of 28 years without a recession is under threat. Global markets see a 40% chance of a recession.
It's definitely a risk that's on the table, so a much higher chance now than, say, 3 months ago of a recession.
And that's why Australia and the world will turn to increasingly desperate measures aimed at propping up the economy. Philip Lasker, ABC News.
In other news, a cybersecurity scare has potentially exposed the private details of tens of thousands of military recruits and personnel.
Defence officials believe no data was stolen, but the incident wasn't publicly revealed until it was uncovered by the ABC. Here's Defence correspondent Andrew Green.
The primary role of the ADF is to defend Australia.
Defending Australia requires a mammoth recruiting operation. Each year, thousands apply. Sensitive details, including medical histories and psychological assessments, entered into an online database. For 2 decades, those records have been managed by a private contractor. Last month, a cyber scare prompted Defence to take the files offline.
Our government and defence networks should be fortresses. No breach can be considered small.
Inside Parliament, senators did their best to discover just how serious the breach was.
I mean, this is a very significant issue. It's been shut down for 10 days, is that right?
We made the decision to isolate some elements of the network while an assessment was carried out.
So, when was Defence first alerted?
We were made aware of a potential security vulnerability on the 24th of January.
The threat was detected after Australia's Cyber Security Centre alerted all government agencies to a broader IT risk. But Defence believes no personal information was stolen.
The conclusion that we've come to working together is that there was no compromise of the data.
Not that those in uniform knew that there was a problem before today. Andrew Green, ABC News, Canberra.
The Chief of Defence has revealed he phoned the Prime Minister to raise concerns about a controversial government video released at the height of the summer bushfire crisis.
General Angus Campbell won't disclose what he told Scott Morrison in the call, but says he was discomforted by images of Defence personnel in the Liberal Party tagged social media clip. Political editor Andrew Probyn reports from Parliament House.
An awful summer the Prime Minister would rather forget. After cutting short his ill-timed Hawaiian holiday by a day, Scott Morrison's team produced a video to spruik what his government was doing to combat the bushfire emergency, even borrowing Defence imagery to make the point.
Authorised by S. Morrison, Liberal Party, Canberra.
The Chief of the Defence Force revealing he was unnerved by what he saw.
I am discomforted, but I did not see ill intent.
But discomforted enough to raise alarm.
Whom did you contact?
I spoke to the Prime Minister, Senator.
Personally?
Yes, Senator.
When I have private discussions with the Chief of the Defence Force, I respect those private discussions, Mr Speaker.
Private discussions, the latest chapter in the sports rort saga.
Can the Prime Minister confirm that his office is coordinating the cover-up?
The Prime Minister's office accused of coaching the Sport Minister the night before he faced a grilling over the scandal-plagued sports grants program.
So 6 p.m, the Prime Minister's staff come to your office to discuss today's hearing.
Well, we had a meeting
staff.
about the issues. Yeah.
Up to their eyes in it, covering up.
Labor increasingly sees Brand ScoMo as a coalition weak point. And at a time when the government needs public trust in its handling of the coronavirus, the Prime Minister has only invited questions about his judgment. For 5 months, Scott Morrison dismissed questions he'd asked the White House to invite Hillsong pastor Brian Houston to a reception with Donald Trump.
That's all gossip.
And may God bless America.
When it turned out to be true after all.
A journalist asked me about it today and I just answered it straight up.
Being straight up, now more important than ever. Andrew Probyn, ABC News, Canberra.
A young adolescent